Welcome to the webinar of the Foundation for Philippine Progress. You are tuning in to the 7th or the last installment of our signature event series called Philippines is in the Heart. My name is Rosella De Leon, Executive Director of Foundation for Philippine Progress, and I'll be your moderator for this webinar. Today's event is Balitang Pilipinas, News from the Motherland. Good afternoon from Portland. We also have people joining from all over the US and the Philippines. So to our kababayans in the Philippines, good morning or magandang umaga po sa inyong lahat. Thank you for joining us. Maraming salamat po sa inyong pagdalo. The Rondalia music you heard playing in the background was generously donated to us by Erna Cruz Louis of the American Center of Philippine Arts based in Oakland. Maraming salamat, Erna. And now for our virtual code of conduct, because we know that this online platform might be new to some of you, we want to go over the virtual code of conduct during our time together this afternoon. Please rename yourself with your name, city, and organization from which you are joining us today. For example, if you click on the participants list, you'll see that for my name, I have Rosella listed, and I'm from Portland, so I wrote Portland, FPP, or Foundation for Philippine Progress for my organization. So if you click the participants list, you'll see that there are 3 dots above your name. You may click that, click rename, and that should allow you to rename yourself. Second, please mute your phone or computer microphone throughout the webinar. Third, please be respectful with your comments and questions. You are more than welcome to type your comments or questions in the chat box throughout the presentation. If you have any questions, please utilize the chat box by clicking the chat button found in the controls in the bottom of your screens. Our staff team will be looking at the chats throughout the presentation. Today's presentation will be recorded and then uploaded to our YouTube page afterwards. You will then receive an email from me within the next 2 days with a link to the recording of this event, and you're more than welcome to share it with your networks. Joining me in different parts of the program will be our volunteer staff team. They are responsible for putting together this webinar series. Thank you very much to our staff team for working tirelessly to make this happen. We have Roger Rigor, our PR coordinator and board vice chairperson. We also have Ronald Antonio, our marketing director. And lastly, we have our project coordinators, Jeline Abenoja and Ai Kalalo. And now I give the floor to Ai Kalalo to talk about her work.
Before we begin today's presentation, we would like to acknowledge and thank the Coast Salish nations of the Duwamish, Muckleshoot, Tulalip, and Suquamish, on whose territorial land we teach, live, and learn. Thank you. This webinar series is brought to you by the Foundation for Philippine Progress. We are a 501c3 nonprofit organization that is dedicated to empower and engage communities in programs and projects for the Philippines to secure quality health, education, and basic human rights for every Filipino. We are based in Portland, Oregon, but we work with communities across the US while conducting our projects for vulnerable communities in the Philippines. And now I'd like to show you our promo video.
The Philippines, Luzon, Visayas, Mindanao, Lumad, Aita, workers, students, farmers, mothers, fathers, grandchildren, nurses, teachers, doctors, (7,000 islands without enough water. Typhoon prone. Vast and rich lands. But the people are hungry. So we've partnered with organizations in the Philippines, nonprofits, hospitals, relief organizations, to launch the Foundation for Philippine Progress. To partner with you for a united, whole, rich Philippines. For a full life for every Filipino.
It will always be a privilege and honor to be committed to an organization that follows a calling for action and compassion. The Foundation for Philippine Progress continues to promote valued relief for 2 years now. The Foundation's collective vision to reach out to those most in need is both inspiring and impressive, furthering its goal of a full life for every Filipino. It has embarked on missions to provide medical and surgical needs to the marginalized in far-flung areas, mobilized immediate and direct help in disaster relief efforts, conducted community education resources and activities for barrios and villages impacted by environmental or social economic challenges. These among many other worthy actions. And because each and every one of you here today has the Philippines in your heart, we are thankful and hopeful for your continuing support through donations, participation, or volunteering efforts. In light of the current state of things the world over, we hope to foster through our actions a more meaningful celebration of solidarity with our Kababayan in the Philippines. In their perseverance beyond the crisis of the times, through our work and programs that reach across the nations and peoples. And so, in the words of Frederick Douglass, the conscience of this nation must be aroused, for it is not light that is needed, but fire. It is not the gentle shower, but thunder. And because each and every one of you here today has the Philippines in your heart, we are thankful and hopeful for your continuing support through donations, participations, or volunteering efforts. And now I will pass it off to Ron to talk about this series.
The 7-part launch of Philippines is in the Heart, our signature event series, is carefully curated as our own contribution in keeping the Philippines alive in our hearts. We want to utilize our platform to provide current and accurate bits and pieces about the Philippine history, culture, food, language, along with the current situation on the ground. We want to maximize our platform to get together with all of you, to discuss any and everything about the Philippines, and be a place where we can have truthful and meaningful discussion about what is dear to us. After all, we know that even though a lot of us are not back home in the motherland, the Philippines is in our hearts. Scheduled around key historic moments such as Philippine Independence Day on June 12th and the Philippine State of the Nation Address this coming July 27th, this webinar series is designed to enjoin participants to learn more about truths about the Philippines through the lens of historians, scholars, community organizers, and our volunteer partners for progress in the US and in the Philippines who are doing tireless work on the ground. We named our series Philippines is in the Heart to honor and commemorate Carlos Bulasan and his work. He was a writer, poet, novelist, and a nationalist who arrived in Seattle in 1930. His story and work have made a difference in the lives of so many of us. Like so many Filipinos, Carlos Bulasan migrated to the US in search of a better life. His experiences and hardships as a new immigrant living in America were documented in his prolific writing and is best known for his novel, America is in the Heart, followed by his collection of short stories, The Philippines is in the Heart. Like Carlos Bulasan, we recognize that for a lot of overseas Filipino workers who have been living in the streets of Saudi, Lebanon, and Hong Kong, because they lost their jobs due to the COVID-19 pandemic, they appeal for help in order to continue supporting their families back home. The Philippines is in their hearts. For a lot of our Kababayan who are not allowed to fly back to their own home country because of the pandemic travel restrictions, the Philippines is in their hearts. For 100,000 Filipino seafarers who are currently stuck at sea and have been longing to go home to their families, the Philippines is in their hearts. For a lot of our Kababayan whose upbringing have been separated from the beauty of the Philippine culture and traditions and are trying to reconnect to their roots through Filipino food, history, culture, traditions, and relearning our language, we know that the Philippines is in their hearts. Filipino or not, born in the Philippines or not, the love for the Philippines is something we all share. Our signature event series exists to honor that. We hope that you enjoy this series that we've put together for you. Now I will pass it back to Sel.
Thank you, Ron. So during the launch of this series, we started a raffle. All the participants of the webinar had a chance to win some prizes that bring us closer to the Philippines. So we raffled off Carlos Bulasan books, Filipino cookbooks, traditional Filipino textile, Tagalog-English dictionaries, and traditional Filipino accessories. To participate in the raffle, we had encouraged participants to make a donation of at least $5 to support our work. So from the last 6 events so far, there were donations that came in who will be a part of this raffle. And then now, we'd like to invite you to be a part of this raffle as well. And if you are so inclined, please share in the chat that you intend to make a donation. Our staff will jot down your names to include in the raffle today. As you will see in the presentations today, these simple acts do so much in changing the quality of life of our kababayans in the Philippines. So please indicate in the chat that you intend to donate, and we will include your names in the raffle basket. If we could go back to the previous slide, we want to show you what we will raffle off today. So for today's event, we will be raffling off a scarf malong from Mindanao. And then again, in continuing to honor the name of our signature event series, Philippines is in the Heart, we of course want to raffle off Carlos Bulasan's book, Philippines is in the Hearts. And then now to introduce our guest speakers. Before I do so, I would like to again encourage all of you to utilize the chat room to express your comments and questions throughout the webinar. Please type your questions in the chat box, which you will find in the menu at the bottom of your screen. Roger Rigor will capture all of the questions and will lead the Q&A portion with our guest speakers after they're both done presenting. And without any further delay, allow me to introduce to you our guest speakers for tonight. We have Minet Aguisanda-Jerusalem, who is the director from 2000 to present of our partner organization in the Philippines, Leyte Center for Development. Minet is also the chairperson of the Center for Disaster Relief Network in the Philippines. In Minet's own words, from the muddy mountain trails of the Visayas to the luxurious hotels of Europe, I've been doing my tasks for the past 40 years, serving the poor and vulnerable. I started when I was 19 in 1980, and now I will be 60 in 3 months. No regrets, living a life that matters. Minet Aguisanda-Jerusalem will begin her presentation, followed by Dr. Joshua Santero. After both presentations, we shall welcome Roger Rigor to facilitate the Q&A portion. And now I give the floor to Minet Aguisanda-Jerusalem.
Good afternoon, everyone. It's an honor for me to share with you conditions in the motherland, specifically in Eastern Visayas or Samar Leyte, where I am based. So next slide, please. Yeah. This shows a graph of the poverty incidence in Eastern Visayas by province. So as you can see, as we all know, the Philippines is rich in natural resources, but majority of the people are poor. Our region in Eastern Visayas is the same. No? In Samar Leyte provinces, we have a showcase of poverty and underdevelopment. So you can see in the graph, this is data from the Philippine government, from the Philippine Statistics Authority. It shows that seemingly poverty has gone down in 2018 compared to 2015. Next slide, please. This other graph shows poverty incidence among families by province. So this is the previous graph was by population, and now it's by families from the Philippine Statistics Authority also. So it seems that they want to show also that the poverty is going down in 2018. Most typhoons which visit the Philippines pass through Samar and Leyte provinces, aggravating the condition of poverty of a population that does not even make an income of $500 in a year. Adding to this agony, pests damaging crops and armed conflict further aggravates the livelihood and affects the livelihood of the people. In the picture, you will see in the lower right-hand corner is a picture of our office after Typhoon Haiyan hit us in November 8, 2013. So you can see we lost everything. We lost our second floor. We lost everything down to the last camera. But we chose to stay on and serve despite the situation. Thank you to our partners and donors. The picture on the upper right-hand corner shows a community in Tacloban City, which was totally wiped out by Typhoon Haiyan also in November 2013. So at least 4 million population affected during Typhoon Yolanda. Next slide, please. So what is the people's response to this situation of poverty and disasters often hitting communities already very poor? So peasants have self-help initiatives like production cooperatives through communal farm work, increased production campaigns in summer communities, enable poor farmers to collectively plan and initiate activities to respond to their short and long-term economic needs. So it's through organized action, through organized peasant fisherfolk associations that the people, the affected communities themselves are trying to help themselves out of poverty and the impacts of the disaster. So aside from their communal farm work, they have individual farms. So the income that they get from the communal farms can add up to the family's income. So in the picture is a vegetable garden organized by the people's organization in this barangay, and it's part of their disaster preparedness program, which us in LCDE has helped to set up and support. Next slide, please. Yeah. So one recent example of a typhoon that hit us just last May 14 this year, 2020, was Typhoon Ambo with international name of Bongfong. So Typhoon Ambo hit hard on communities already very poor before the typhoons. The towns of Hipapad, San Policarpo, Arteche in eastern Samar, and Lapinig town in North Samar were the hardest hit. 95% of the coconuts were damaged, and it takes 7 or 8 years before the coconut tree can be productive again. This is a great impact, especially that majority of the farmers depend on copra or coconuts for their income. Next, please. So this is a video that we took on the ground while distributing seeds from vegetable seeds from Foundation for Philippine Environment. Can we view the video, please? Partners from the Foundation for Philippine Progress. I am Minet, Aguisanda-Jerusalem, Executive Director of the Leyte Center for Development. LCDE, we are a local NGO here operating in Samar and Leyte, and we have been long partners of the Foundation for Philippine Progress based in the US. So right now, I am here in Hipapad town of Eastern Samar. Hipapad is about 7 hours from Tacloban City, the capital of our region. And we are distributing vegetable seeds. Thank you to the Foundation for Philippine Progress in the United States. We were able to purchase vegetable seeds for poor peasants of Hipapad in Eastern Samar who were victims and survivors of Typhoon Ambo last May 14, just this May 14, 2020. So Hipapad is a very mountainous municipality. The people here derive their income from farming. They're mostly coconut farmers. And after Typhoon Ambo, 95% of the coconuts were damaged, totally damaged, and it takes 8 years before a coconut can be productive again. So you can imagine the impact on people who already so poor, making less than $500 in 1 year, in 12 months. So really very poor peasants. So what they really need now is food and livelihood. So we decided to come back to Hipapad after we came here to give initial food distribution 4 weeks ago. We came back now, today is July 9, to give these vegetable seeds from the Foundation for Philippine Progress. So with me now is one of the community people in one of the barangays here, Dorillo. Her name is Jennifer, and she is a barangay secretary of Dorillo, who came here with her other community people. Can we please show the others? So these are her other people from the barrio, Cagmanaba and Dorillo, who came here to get these vegetable seeds. So as you can see, we really put the logo of Foundation for Philippine Progress. Maraming salamat. Thank you again. And we can ask Jennifer here. So, Jennifer, anong kamutangan niyo? Yan naapekturan ka mo ng Typhoon Ambo Mayo.
Sobrahin kakuri dirihan ng barangay kay ulog na kami ng mga pobre yung waraulog kami anong pakabuhi lukad la ang lubi pero kay ini nga ginato nga ambo mamakuri pagod kay 95% doon nga mga hibang anong mga kalubian.
So, Jennifer is just reiterating what I just said, that they are in a very difficult situation. They don't have enough food. No, they just survive on root crops after Typhoon Ambo hit them last May 14. So, in a nutshell, she says it's very difficult. They hardly have any food. So, Jennifer, tiunaw ka mo nagsusurvive, nakakaya niyo. Ay, ka mo nagkukuhan pagkaon nga, wala na ang mga lubi.
Kay ininiyan nga nagre-renilip ham, asyalan amon niya natatagamtaman.
Pero okay naman.
Kay asya na nga ni ito niyan, anong ginihimo, ini nga mga hatag kong tahayo, asya na lang ang magpapanano. Ini kaya mga may duma daman, pero kay binahaan man daman, tapos kukuan daman kanan bagyo, nagkakatumbahan
Paano ka nakaon?
Kay ang ibahan hani, kay may managbabari man hera, di ba, unahan, antis kunta mag Typhoon Ambo, asyet niyan, anam din tatalagutian ng pagkaon.
Yeah, so Jennifer here is stating that they just rely on the meager relief, and now there's no more organizations or government giving them food support. So they're very thankful for the vegetable seeds from the Foundation for Philippine Progress, which can add to the food, no, when the vegetables are harvested in a month or two. So, Jennifer, ano man imong panawagan ang mga naghatag ini sa
kay ang amon panawagan din ang amon barangay, dako anong pasalamat ngay may bulig haamon nga nadatong sobrang gud anong pasasalamat nga may nahatag haamon kay uno gud kami nga mga pobre.
Okay. So she's saying thank you very much to the donors. And by the way, it's not only these vegetable seeds that we in the Leyte Center for Development are giving, but we also have hygiene kit here from our donor, Care Philippines. and Colgate Palmolive. Along with your vegetable seeds, we are also giving 12 bars of soap to each family, to more than 5,000 families, and sanitary pad. So we decided to sanitary pads and bath soaps. Okay, so Jennifer, damo nga salamat. So hinaot nga makalagpay ka mo hini. Friends and partners, again, I am reiterating that we're in a very poor municipality. I think this 5th or 6th class municipality. People already so poor for decades. And with the series of typhoons and with the COVID pandemic, which aggravated the situation. Why? Because they cannot seek jobs anymore in the big cities as household helpers or construction workers. So all the more it aggravates the crisis they are in. So thank you very much, and we hope for more support from the Partners for Foundation for Philippine Progress. Salamat. Thank you very much.
Good day to everyone, and in behalf of the municipality of Ipapad, Eastern Samar, I'm your humble mayor, Dr. Benjamin Ibardo, and I would like to thank all the donors who came to help us after the onslaught of Typhoon Ambo, and specifically the Foundation for Philippine Progress, who give us vegetable seeds to more than 300 families, and also to the Colgate Palmolive Care Philippines, who give us also some soap and other sanitary pads to all about 2,000 families in Ipapad, Eastern Samar. And I think this help that be possible without the help of our counterpart, local counterpart from Leyte Center for Development. And to all of you, again, thank you so much for helping us, the people, my constituent of the Ipapad Eastern Samar, and this will be a great help for us. And we are still hoping, for hopefully that you will still continue to help us, for we know this is not just the end of the it's not just the I think this is just the beginning of the hardship that our people in Ipapad will try to feel, because our main source of income here is copra, which 100% of it has been devastated by Typhoon Ambo, and we feel that this will be productive again for at least 5 to 7 years. So it means within this year, the poverty and hardship of our people in Ipapad will be greatly felt, and we are still hoping for your help. And again, thank you in behalf of Ipapad Eastern Samar. I am your humble mayor, Dr. Ver. Thank you so much, and God bless us all.
Okay, yes, so these videos were taken a week ago when we were on the ground doing distribution and having consultations with local government officials, as well as the villagers, those in the communities themselves. So what do the survivors need? They need livelihood. They badly need livelihood, alternative livelihood. So the Foundation for Philippine Progress has always supported LCDE's emergency response and advocacy. So next slide, please. By the way, I want to share with you that Hipapad town, where the video was taken, just had their electricity some 8 years ago. At this time and age, before 8 years ago, they had no electricity. And the mountain barangays of Hipapad just had their electricity 3 or 4 years ago. So that's how left out many towns in the provinces here in the Philippines are. Yeah. So what is the response of the government through all this? So the Philippine government has what we call, as you can see in the slide, Ambisyon Natin 2040. it's really an ambitious project which relies on three main platforms for this program. So what does the government support? The government support is meager compared to the huge need for livelihood, shelter, and other basic social services. LCDE with its partners strives to campaign for resources to support people's basic needs. And of course, the Foundation for Philippine Progress helps us in this effort. So what is Ambition 2040 of the Philippine government? It has three platforms. The first is Filipinos are strongly rooted or matatag, meaning the family is together, no more OFWs, time with friends, work-life balance, and volunteering. The second platform is Filipinos are comfortable, meaning maginhawa. So this means Filipinos are free from hunger and poverty. There is security in home ownership, good transport facilities, and travel and vacation for the family. Third platform is Filipinos are secure or panatag. This means that there is enough resources to meet the family's daily needs. There is peace and security. The Filipinos have a long and healthy life, and there is comfortable retirement. So this is the main platforms of Ambition Natin 2040. They focus more on infrastructure. So we in the CSOs have a huge critique about this whole program because the Philippines is an agricultural country, and yet the government focuses on infrastructure and not developing the rural areas or the countrysides where most of the people live. Next slide, please. So we expect an increase in poverty along with the COVID-19 as President Duterte goes on his fourth year as president. So the people in the communities share to us that the COVID-19 pandemic has pushed them further into poverty because they have no other options, unlike before when they can go to the cities and look for jobs. But now with the military type lockdown, one cannot easily travel from the rural areas to the big cities. Next slide, please. So what is our response? What is LCDE's response? So LCDE has programs supporting people's livelihoods and disaster preparedness. We have been doing this for 32 years since we were organized way back in 1988. We also support people's initiatives to mitigate the impact of disasters through capacity building, livelihood, and organizing. Yeah, so on the picture is our relief missions. This was after Typhoon Haiyan hit us. We did shelter kit distributions. We did vegetable and rice seeds distributions. We did food distributions to affected communities. Although we were victims and survivors ourselves of Typhoon Haiyan, as you saw in the previous slide, we helped 23,000 families in the 5 months after Typhoon Haiyan from 3 provinces in more than 30 towns that were totally hit by in the 500 heavily hit kilometer radius of Typhoon Haiyan. Next slide, please. Next slide. Okay. So this just goes to show that we want to share that LCDE actively partners with the Philippine government, agencies, local government units. We also have numerous citations and awards from the Philippine government. In the lower right-hand corner, the picture shows former DSWD Secretary Dinky Soliman and the Regional Director of DSWD at that time. We were in 2011, we were having a memorandum of agreement signing that LCDE and DSWD cooperates in delivering social services to poor and hard-hit communities. Next slide, please. Yes. So, what are the challenges that we face? One of the biggest challenges now is the persecution of humanitarian NGOs. Even before the passing of the anti-terror bill, NGO development workers like us have been the subject of harassment, arrests, intimidation, and even murdered in the past few 15 or even more years. No, all the more now because the bill is a bill. It's already a law. It was signed by President Duterte. Next slide, please. So our call is still onward. In Bisaya, it means padayon, patuloy. The call to continue serving the poor and vulnerable communities. And we really need reliable partners like the Foundation for Philippine Progress, who helps support our advocacies and even our programs. So in ending, I would like to share with you some lines from Nelson Mandela, who I admire. It's about poverty. So it's in overcoming poverty. Overcoming poverty is not a task of charity. It is an act of justice. Poverty is not natural, just like slavery. It is man-made and can be overcome and eradicated by the actions of human beings. Sometimes it falls on a generation to be great. You can be that generation. Let your greatness blossom. For to be free is not merely to cast off one's chains, but to live in a way that respects and enhances the freedom of others. So maraming salamat. Thank you very much, Foundation for Philippine Progress, for helping us every step of the way. Salamat.
Maraming salamat, Ate Minet, for such an eye-opening and inspiring presentation. Our next speaker is Dr. Joshua Santero. I think I actually just saw him enter the room. So I have to share that, throughout this webinar, I've been communicating with Doc Josh because I know that he's also on duty, and we were prepared for him not to, like join us right away on time, or even maybe join us later on in the presentation, because we know that, like these decisions are really true to his values. He always is able to prioritize the people who need him more. And while he apologized, actually, like I want to say that we do understand, and instead we thank Doc Josh for prioritizing the people all the time. I want to share that, I first met Doc Josh in 2018 when Foundation for Philippine Progress joined a medical and surgical mission in Eastern Visayas. And during that time when some families arrived a day or two early, Doc Josh actually made a decision to, to see them and to treat them right away and not make them any longer. And this is knowing that, a lot of these families who came to see us, like had to cross rivers and mountains and had to, ride multiple multiple like motorcycles and tricycles and jeepneys just to get to where we are. And just to introduce him, Dr. Josh Santero, he is a graduate of both anthropology and medicine from the University of the Philippines. He is a co-convener of the Coalition for People's Right to Health and a community physician for the Council for Health and Development, working with a community-based health programs across the country. CHD, or Council for Health and Development, is our partner organization in the Philippines. And now I want to introduce you all and give the floor to Doc Josh Santero. Welcome, Doc Josh. The floor is yours.
Hello, good morning, everyone. So, I'd like to apologize for being a little late to the forum, but I think I came in right on time. So thank you again to Ate Rosella and to the Foundation for Philippine Progress for inviting me to this forum series. I think this is your last webinar for this series on Balitang Pilipinas. So I know that a lot of you are curious about what is the situation especially in the Philippines with regards to to health in general, as well as with the pandemic. I know that we're all facing this threat of COVID-19. It's a big problem in all over the world, especially even in the U.S. and especially in the Philippines. So I just want to share basically what is it that the Council for Health and Development is doing, especially the Coalition for People's Right to Health, which is our one of our we are the secretariat of a larger coalition that deals with the right to health, and it's part of our advocacy arm in the Council for Health and Development. And I would like to have a short sharing with regards to that. So as Rosal mentioned earlier, so I'm a graduate of medicine last 2016. So it's one thing when you're learning about the health inequalities in your country as a medical student, and it's another thing actually finding out about it when you are able to go into the field. That when you are able to see those health inequalities in the face, when you're able to see those situations, especially outside the medical school and outside the cities, and you're able to go into the areas where apparently health isn't it is actually something that shouldn't be taken for granted. That there are a lot of communities in the Philippines that have to deal with health situations that are less than ideal, that do not have access immediately to urgent care or to even basic health services. And that's something that I realized even as a medical student, even especially when we started to do some field work and as part of my elective work, and eventually when I started working as a community physician. Instead of just working in a hospital, there are much larger um, health challenges in community, especially this one. So this picture was taken in Davao del Norte, in Talaingod, in one of the mountain ranges in the indigenous communities of the Manobo in northern Mindanao. So these areas are, um, these far-flung areas are really unable to get most basic services. So this is a picture from then, no? When I was able to do my elective with one of our community-based health programs in southern Mindanao, in Davao del Norte. So in these areas, you see how remote it is, no? On the on the picture on the right. No? But even the most basic services, even potable water is actually a challenge for a lot of these communities because of the threats to their indigenous land, because of logging and thus potential mining interests, for example. So it makes it difficult for some individuals to actually have those resources. So there are a lot of disease, especially for the younger children. So one experience for me that actually opened my eyes a lot with regards to these health situations, um, in these communities, in several indigenous communities in the Philippines, um, when we talk about child and infant mortality, it's actually a really big thing that it has actually gone into their culture. So, for example, in this community, um, these when I was able to when we were able to find this infant, for example, this sorry, not infant, this baby, she was, I think, around um, barely a year old, and there were a lot of problems with regards to potable water. So there was there's some issue with dehydration. So the child was having diarrhea, and we had to give the antibiotics as well as the IV fluid. So I don't know if you can see here that she already has this IV line, the intravenous fluids, because we had to hydrate the child. And this is actually a very common occurrence, that there is a lot of dehydration. There's a lot of disease among the young population, and thus it's not surprising that there are a lot of children who die before reaching the age of 1 or even 3 years old. So it's actually gone into the culture of some of the indigenous people. So when I asked for this baby's name, the mother told me that they don't name the children yet. No, and, it is a cultural acceptance that you don't name the child until around 3 years old, 2 or 3 years old, because at that time you're more sure that the child will progress towards later childhood and all. No? So they don't name the child so that there's no emotional connection yet. So if ever the child dies before the age of 1, since you haven't named the child, um, there's no emotion. There's less of that emotional loss, you know, that heartbreak that parents feel when those children do succumb to their disease. So it was really something that that is ironic, no? That it's something that poverty and really having a poor health system in these areas has shaped the culture of these people. So it's something that persists, in a lot of rural areas in the Philippines that do not have enough health care. So I just want to show this graph, that was this map that was made by one investigative journalism institution in the Philippines. And basically, they're just showing here how bad it is in some areas of the Philippines when it comes to two things. First is the rural health units or the health centers. So the basic health services, how distributed it is among the people. So on the left side in the orange map, this is how it looks with regards to how many people have to share in a single rural health unit. So as you will see here, the majority of the more orange parts are in Mindanao, the southernmost island in the Philippines that has a lot of health disparities. So Talingad is somewhere here in the middle of Mindanao, so in the northern part of Davao. So as you will see, it's Mindanao that really shares a lot of the problems with regards to the lack of rural health units and the basic health centers and the basic health service provision. There are areas as well in the Visayas, and then surprisingly, even just south of Metro Manila, in Cavite and Laguna, and some areas that have to share in the very few health resources. And the one on the right is with regards to the government physicians. So how many doctors are there with regards to the population? So in the Philippines, our ratio is there is uh, uh, one doctor for every 33,000. So it's um, really difficult with regards to for most Filipinos to be treated with these things. So actually, even before 2018, the data was showing that around 6 out of 10 deaths are actually unattended by a physician in the Philippines. So it really just shows how big the disparities are with regards to health, and it's something to see it on a map and all these data, but it's also another thing to see it in these communities. So that's something that the volunteers of the Foundation for Philippine Progress saw when we went to Samar in 2018. So surprisingly, the map shows northern Samar having relatively, better, but it's another thing again to see it actually on the ground in some areas that are impoverished in northern Samar. And I'm sure Ate Rosel and those volunteers who actually went with us back then were able to see firsthand, in some communities that are really unable to access even the most basic of health services. So imagine this is the type of communities and this is the type of health services that are present, and then all of a sudden you have the threat of COVID-19 coming into the country. So how has the Philippines been faring, with regards to this poor health situation, that our health budget and health infrastructure haven't been well enough to cope with the old normal, and what more this time with COVID-19. So I just want to show this small graph on how it looks like in the Philippines. So we had our first case of COVID-19 in the Philippines in January. So we first had it from a Chinese tourist. We had 3 Chinese tourists have it from January to mid-February. And then because the Philippines wasn't really ready to have those testing facilities, we just had those 3 cases that we identified. And then for some time, there were no identified cases because we had limitations in testing. And then we only really started to see the cases pick up in March. So it started to pick up in March and then skyrocketed in June and July. So now we are averaging around more than 1,000 per day in the past few days. So as you will see here, we started with around 0 cases in March. We had our first cases in the middle of March and the beginning of March. So before March, we had 0 cases between those 3 Chinese tourists, and then having our first local case in March 5. So on March 5, we had because prior to that, we had our so the 3 cases were tourists. The 4th case was a returning businessman from Japan, and then the 5th case was a vendor in Green Hills. If some of you are familiar with that shopping destination in Metro Manila, so he was a vendor, and then eventually his wife, who was patient number 6, contracted it, and they were not sure if they had any exposure since they did not have travel history. One thing that they were considering is that maybe they got it from tourists, but it was no longer identified. So the fact that they got the infection from the community really identified that there was some local transmission in the Philippines by March, and then the cases continued to rise from then. And so we had more cases in April, and then it relatively plateaued. So we didn't flatten the curve, but the curve looks flat because of plateauing. And then eventually towards the tail end of May, since we started to have more testing, but still inefficient and insufficient testing, and then the cases started to rise since then, especially June and then now in July. So this is how it looks like as of yesterday. So the official announcements by our Department of Health mentioned that there are a total of 65,304 cases as of yesterday. So it's in line with the predictions that the worst case scenario predictions in June, that we would reach 65,000 cases by July. So it's really sad with regards to the fact that in May it was, much less than half than the number of cases now, and it's really been going up since then. And the ironic thing is that how the Philippine government has been presenting the data. So apparently it's not good to show that we have 65,304 cases. So the government prefers actually to just show the total number of active cases. So it says here 41,464. So that's subtracting the recovered and the patients who have died from COVID-19. So it's more, it might be more palatable for people to just see the total active cases instead of the total cases. And it's really frustrating on some parts because on the ASEAN level, in the Southeast Asian nations, the Philippines is actually number 2 with regards to the total number of cases, but only Indonesia is leading us. But before, so now we have more cases than Thailand, than Singapore, and these countries are already starting to end their first wave. There are some instances of actually Singapore is already ending its second wave. So with regards to the Philippines, it's still just one ginormous wave, but still it's ironic that we're just focusing, the government is trying to just focus on that total active cases instead of focusing on that total cases, since it's more rattling. But even with regards to the total active cases, we're now actually neck and neck with Indonesia. But despite that, a lot in the government is actually patting itself on the back because it's not having millions of cases like in the US, which is a strange way to congratulate yourself. But they're saying that because of government action, we're not as bad as the US. It's a little strange lang, no? But so they're actually claiming that they saved thousands of lives, because if they had done worse, it would be like Brazil or the US with millions of active cases. So, but the fact is, there's no sign of the 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 infections actually being controlled, even in Metro Manila. As you see here, the top provinces that are announced are in Metro Manila, still in NCR with 1,824 cases. So of those 2,357, more than half of those come from Metro Manila. And then there are still outbreaks in nearby regions, no, in Laguna, Cavite, and even Rizal, as well as Cebu. So going back to the slide I showed earlier, it's actually similar to how the health system is actually not prepared. No, not just for a pandemic, but even the basic health services. Since we know that it's not just about testing, it's not about tracing, it's also about the basic level of health of your community. So even here, no, these orange areas, this is Cavite, this is Laguna. So these areas are badly affected as well, and it's also reflective of the fact that the health system actually isn't prepared, that the health system has been neglected, and thus it really shows that even with regards to the control of a pandemic, it shows, that how people are being are not in good health, and whose health are still being taken for granted even in this situation. So this is something that we created on the Coalition for People's Right to Health, on why it's taking so long in the Philippines, because there are a lot of delays and backlogs. So just a short overview to why there's such problems in the Philippines with regards to COVID-19. Sorry, I might be talking too much about this already. But there's a problem with regards to some people are not being tested immediately. So some people, there's a prioritization scheme that people who have symptoms are prioritized over those who don't. So those who have severe symptoms, those who are elderly and with hypertension, diabetes, and who have symptoms are prioritized over the other patients, which is well-intentioned. But the problem is that those who are asymptomatic, even if they do have contact with positive cases, are not prioritized in the testing. So in areas where there is poor testing, they are actually not tested, unfortunately. So there's that delay between the time that you should be tested into the time you're actually tested. And then there's also that problem with regards to how many laboratories should be handling those cases. So in the Philippines, we only have 88 laboratories. So in other countries, they have more than 100. And for us, it's been 4 months already of facing this, and we still just have 88 laboratories, and that are more spread out in the cities rather than the rural areas. So in that sense, there's that problem with regards to how long it takes for those samples to be actually tested. And then there's another problem with regards to validation, because we have this problem with data management, that once somebody tests positive, we have to ensure that those cases are actually real people. And there's that problem with data management, having to send the problem with centralization and other sources of those laboratories. So what happens is that it takes longer. The reporting is not real time. So there are times where the cases, we know that somebody has already tested positive, and it takes several days before we actually find out in the news that those cases have been added to the total count. And that's another, it's different from the problems, how long the test results come out. In the States, I know it takes around 24 to 48 hours. In the Philippines, it takes a minimum of 48 hours and a maximum of 3 weeks. So there's a lot of problem with regards to the backlog that the laboratories have to deal with. And then there's the problem with contact tracing, that we have to find the contacts, but the contacts are actually only being found once somebody has tested positive. And then it takes so long for the people to actually, I know this is similar to what is going on in the US as well, but compared to our other Asian neighbors, we really are lagging in all of these things. So I want to focus on what the Council for Health and Development has been doing on the level of the community with regards to this. So it's really about social solidarity during this time of a community quarantine. So I just want to show two community-based health programs, specifically some urban poor areas in Quezon City. So in these areas, this was during the ECQ, our enhanced community quarantine, when we had a major lockdown in the Metro Manila. So we really have to address those basic needs during a lockdown. So in our communities, we're able to provide the communities themselves tried to provide for food and water. So there were difficulties in attaining food because some people couldn't go out of their homes, and there are limited resources for that the government was willing to um, to give out, no, to these communities. So it was the communities themselves doing these things. So again, the problem is that we keep on doing social distancing, but we've actually distanced ourselves from the social realities as well. So we really need to be distant, but only physically, but not socially, because that's the problem when we are too socially distant, but we actually dismiss the plight of others, especially in these communities. So something that we do with strengthening our community-based health programs is really strengthening that social solidarity. So we try to these communities that we help train are able to provide for the food, the water, as well as the economic aspect as well. Okay. So there's also that problem with regards to the lost income. As for example, you will see here the picture with the pedicab drivers, those who are unable to provide for their families because there is no transportation services. So that's something that the communities are able to help pool some money so that these communities would have some minimal income, and the provision of the essential health services. So as when we train our community health workers, I think some of those in FPP might be familiar with our work. So that's in creating community-based health programs, we train community health workers so we can give even the essential health services. We can advise on nutrition, on preventive services. So that's really how we look at health. No, it's not just about treating the diseases when they're bad, but preventing disease as a whole on a community level. So, and then we realize that there are much bigger needs. No, that we realize that there is problem with housing, with shelter. That these things are problematic in the Philippines, especially in urban poor areas. That without housing as a right, we see that more people live in communities that are so close to each other that you can't follow those physical distancing protocols. So when somebody has to be a meter apart or 2 meters apart from someone else, have with having a home that is less than 4 square meters, that means that some family members would have to be on the ceiling when you have to follow those social distancing protocols. So it's really difficult for a lot of urban poor communities to follow these things. So it's really a matter of privilege as well that we consider doing quarantine in a lot of communities in the Philippines. So human rights as well and dignity, that you see that the problem, some of you might be seeing those problem in the Philippines, that it's become a matter of policing and a matter of some people looking at having COVID-19 as a crime, that the police have been looking for these suspects that have COVID-19 and looking for their contacts or accomplices. It has been framed in that metaphor, unfortunately, which is really problematic to the human rights and dignity of patients that have COVID-19 and the rest of the community. And another thing that we do is to seek those active community engagement. So the participation of our individuals rather than just enforcement, that we have to increase the social awareness of these communities so that they know what should be done during a pandemic. That they do practice the physical distancing protocols, but they do realize what has to be done. Why are things like this with regards to our pandemic response and our overall health situation? So we demand the action and the accountability, that people take it into their own hands to protect their own communities and to demand for better testing and to demand for better assistance with regards to living conditions during this pandemic. Because how will you be able to follow pandemic protocols when you're hungry and you have difficulty attaining your daily needs, no? And if you're not tested for the disease. So basically, these two things in trying to provide for basic needs during a lockdown, in doing active community engagement in our communities, it helps empower the communities to better interact with authorities rather than them doing it individually, that they are able to face the larger authorities, and at the same time with the community health workers, with the stronger community engagement, you're able to not just meet the authorities but also provide referrals to higher levels of care if they need it for their health problems. So that's something that is currently being done. And of course, really, it's heightening that awareness, and that Council for Health and Development has been demanding from government to improve its services. And something that we've recently done is to go to the Supreme Court and to file a petition that is seeking that the government force the rest of government to actually conduct better testing, because during a pandemic, because of that prioritization, that some people are prioritized over others, there are people who are unable to be tested, not just because of that prioritization, but actually because of cost. That for some people it isn't free, and thus they have to shell out of pocket expenses, and because of that, it hampers on the right to health of these individuals. So that's something that we forced the government to do with a petition for mandamus, that is requiring the state to perform free and mass testing for its population during a pandemic. And that's something that we hinged on the right to health. So that is something that we have been doing with regards to how the government has been dealing with COVID-19, and basically being accountable to the right to health of individuals. So this is one of our campaigns that we really have to go beyond flattening the curve. We've heard this so much, that one of the campaigns of the Coalition for People's Right to Health is that we don't just look at the curve to flatten, but we have to skew that curve with better social protection, with better welfare and empowering the communities. But at the same time, we raise the bar, that we have to increase the capacity of our healthcare system, that we should question why it's just stagnant, or even maybe falling down. It has to continue to rise to meet the better health services for the people, greater healthcare support, more hospitals, more testing, more health workers, so strengthening the real front lines, which is the community, better workplace, better healthcare in the workplaces and schools. So this is really our call, no? That more funding be put for health and more support be given to the health sector. And and this is the not just for the pandemic, but for the bigger right to health, looking forward for the rest of our population. Okay, so this is a picture lang going back to the time I was in Talingon. So because that was a mountainous terrain, so there have been several times where there were landslides in those areas, but the community themselves were able to find a way around it and make a path despite that disaster. So this isn't really about resilience, but it's more about how our communities are able to empower themselves despite government inattention. But these are small things to do. Of course, the better thing is to have stronger social support, no, and better protection measures and welfare. But of course, the people are able to find a way. At the same time, during this pandemic, we have certain individuals who still continue to provide for better healthcare and then provide what support that the people need as part of their right to health. And that's something that we still attempt to do at the Council for Health and Development, and something that we were able to do to provide for more equipment, especially through the donations given by the Foundation for Philippine Progress as well, that we were able to give the some equipment to our struggling healthcare workers, to our struggling frontliners as well in the emergency rooms. No, but again, as I mentioned, the real front lines are in the community. Those in the hospitals are actually the back line already. But that's what happens when you don't have a strong front line. It's really the hospitals that are overwhelmed because at the level of the community, there's practically no services that are being given. So those in the back line are so overwhelmed. Those in the hospitals are overwhelmed. The Philippines has over 3,000 health workers that have been infected by COVID-19. We have 34 health workers who have died since then. And for the most part, a lot of our healthcare workers continue to be neglected with their wages and their benefits. And, being able to donate some equipment for them for their own personal use and the use of their facilities is something, such a big help already because of the neglect, that is given to our healthcare workers. So having their own equipment, some although we would prefer that the government actually fund these areas and these facilities and these services, and especially better salaries and benefits for these healthcare workers. But of course, um, we're able to provide the much needed personal protective equipment and supplies to our frontline health workers. That are providing the care in this very difficult time. So again, the Council for Health and Development would like to thank the Foundation for Philippine Progress for their support. And yeah, actually, the Council for Health and Development is actually celebrating its anniversary, I think, yesterday. So again, on behalf of the Council for Health and Development and the Coalition for People's Right to Health, thank you very much again to the Foundation for Philippine Progress. And we really have a lot of work to do with regards to going beyond flattening the curve and attempting and ensuring that the government raised the bar when it comes to health, and especially our standards for governance in health in our country, and improving that overall health situation. So thank you very much for inviting me, and looking forward to our discussion. Thank you very much.
Maraming salamat, Doc Josh. Thank you din to Ate Minet for your presentations. And now for facilitating the Q&A portion of this event, I welcome Roger Rigor.
Thank you, Sel. We are indeed very fortunate to truly have with us two very compassionate and committed Kababayan. Definitely, the Philippines is in your heart when you have devoted your life and focus for those who continue to struggle. So I have very few questions here in the interest of time. First, for both of you, considering all the barriers to serving the underserved, and Ate Minet, you can start with this, and then maybe Doc Joss can follow suit. What keeps you both going? What makes you do what you do? Just so that people can have a sense of who we are actually dealing with in the Philippines as a foundation, and as we try to do outreach to get the support for us to bring funds to you. What keeps you going? Ate Minet.
Yeah, so thank you. Thank you for the question. So for me, what keeps me going is the commitment, the dedication and courage to serve the poor and vulnerable, people who don't have much in life. So like during Typhoon Haiyan, it was the most difficult in my 40 years of doing the work I do. Typhoon Haiyan was the toughest. So what made me stay on was thinking of other people who were much poor and who didn't have any options compared to me. I was a victim, I was a survivor, but I thought of the thousands, even millions of people who needed my help and the leadership that we needed to do for our organization so that we can help the affected communities. Yeah, and as I always say, in every challenge, fear, we are fearful, fearful for our lives, for our families. But fear has two meanings. The first meaning is forget everything and run, or face everything and rise. And I always do that. I face everything and I become stronger after every challenge. Yes.
Thank you, Ate
Thank
Minet.
you.
Dr. Joss?
Yeah, it's been, yeah, it hasn't been easy. Especially seeing all those, it's difficult in itself, especially seeing all those suffering around you, with regards to things, and how, despite me being here for the past 4 years, it's the improvement hasn't been, something that is easily seen. But sometimes in the communities, you're able to see that passion of those individuals who really are going all out just for their community. So not just in those, in the urban poor areas, in the community health workers who really want to find more about their own health, because they know that how difficult it is and how expensive it is to see a doctor and to regularly see those health workers. But for them to want to be empowered with regards to healthcare, be able to teach their fellow community members about prevention, about nutrition, that drive, when we teach them, when we engage with them, it's really inspiring, especially even in those indigenous communities, that those who haven't learned to read and write in their younger years, they themselves are the ones who want to learn how to read, and to be able to serve their communities in their full capacity. It's inspiring for a lot of us who have had, so many other privileges, but are focused on our own careers. And it's really something to see how a community comes together, with regards to healthcare, that it's really not just about an individual doctor or nurse treating patients, but rather a community that's doing what they can for a larger concept of health. It's really refreshing sometimes, that it's really not just about us, it's not just about the patient or a doctor, it's about a community that is tending to the needs of their neighbors.
Thank you, Doctor. Yes, indeed, it is a community that is faced with the challenge of making a people more empowered, right? And so you both mentioned the meagerness and the challenge of having a government that is short of being unresponsive. Um, so, in spite of the narrative that we have been hearing from government about the optimism that the future build projects, uh, why do you think to this day there is this stagnation on over reaching out to the most rural folks? What seems to be the continuing problem that you find is in the role of the government? At the minute, you can start, and then Dr. Joss.
Okay. Yeah, so in my 60 years in this world and 40 years in this kind of development work, I would answer your question in a straightforward manner. So it's always been like this because the past administrations, they have a system of corruption, treachery, oppression, and really anti-poor the past centuries, even centuries. So that's why we're still like this. So that's why we in our organization, we try to support and build a strong people's movement, which starts in the grassroots, working towards short and long-term goals, because that's the only way we can really empower and really liberate our people from poverty and oppression. Yeah.
Thank you. Dr. Josh?
Yeah, I guess a lot of those in government and those in our leadership, maybe these realities are taken for granted. Sometimes, maybe it. I think with build in these projects, they seem to be relatively short-sighted. So some people still think that by by having these projects, we're able to improve the level on the grassroots. No, so sometimes by having more roads and more infrastructure, it, it there's that notion that maybe it will trickle down development to these rural areas. But the problem is that these rural areas do not have even the most basic of services. That are we are able to fund roads, but we're not able to fund uh, proper healthcare. We're not able to fund proper food security. So there are still some elements that are, are not are overlooked with regards to the welfare of a lot of people, and that that development becomes uneven, and because of that, it perpetuates that some areas are poorer than others, and so that most of the improvements are in certain cities only. But as I showed earlier, even just outside Metro Manila, you already have a shortage of doctors, you already have a shortage of health facilities. So it's kind of ironic that really we're all focused on the cities, and it's really those areas that are developing really leave behind those areas that are not. So it really gives not just for disparities in development, but also in healthcare and in welfare and the rights of these individuals.
So thank you, Ate Minet and Dr. Josh. So in this whole ambition project that this current administration has been promoting, how realistic is this then? Is it in very short, is it yes or no? Ate
For
Minet.
me, it's definitely a no.
Mhm.
Because look, one of the goals is Filipinos are comfortable, meaning the indicators state that there's freedom from hunger, there is secure home ownership, good transport, and even travel and recreation, vacation for families. I don't think that will be realistic, especially now with the pandemic and with the corruption and how the government responds, not even in the next decades. Yeah, so it's really ambition.
Yes, thank you, Dr. Josh.
It's a little worrying.
Mhm.
I am personally worried with regards, even with regards to COVID-19.
Mhm.
Let's just use that as a metaphor. I
Mhm.
think I'm worried that the Philippines might actually really lag behind. It already is, and it's a little frustrating that um, a lot of our other neighbors are already thinking about opening up. Like even Taiwan and Vietnam are thinking about opening up themselves to tourism and everything. And it just seems like the metaphor for everything else that has been going on with regards to our development, even with regards to food security, that initially the Philippines was doing okay, and then eventually we stagnated with regards to our rice production, and it's worrying that we might actually be left behind with regards to our healthcare and everything else, no, that has been going on right now.
Thank you, Doctor. And so it makes it even more compelling in our attempt to send this message across our kababayans here in the U.S., outside of the COVID, and also taking into mind the vulnerability of our communities in the ever increasing calamities based on a weather that is changing. And I'm sure Eminet can actually agree with me that this whole uh, typhoons are getting worse. So in your final appeal to our kababayans from here, what would be your final? I mean, in this forum that we have today, in the hope that we reach across our kababayans here, and of course the situation is not at all rosy as our government has always been trying to convince people. But what would be your final uh, appeal at this moment?
Yes. So for me, I would like to thank the Foundation for Philippine Progress for supporting our programs on disaster preparedness, for always being there for us after every calamity. My message for our kababayans in the US is that remember, our problems are interlinked. So our solutions should be interlinked. We must forge the strongest solidarity and partnership in facing a common oppressor that oppresses the people in the first world and in the countries in the third world like the Philippines. So here is looking forward to an ongoing partnership and in meeting the challenges as partners, going beyond resource generation, going on to real solidarity partnership in terms of advocacy, resource generation, people to people exchange. This is what matters now in this very dark and bleak time. So maraming salamat kababayans in the US. We welcome you. We can host you here in the Philippines, in our region. We welcome you to come to our communities, visit our communities. We've been doing that, by the way, the past years, hosting US PhilAm groups, bringing them to our community. So once more, maraming salamat.
Thank you, Ate Minet. Dr. Josh.
Yeah, so Ate Minet is correct, no, with regards to dealing with solidarity. That solidarity is really important. Going back to, again, the metaphors we've been hearing around about COVID-19, since it's all in the news and it's all I can think about right now. With regards to that, when we talk about, everybody's talking about social distancing, and social distancing is not new. It's not just because of this pandemic. A lot of people have been socially distant for a really long time, and you know, it emphasizes that distance between the center and the periphery, that distance between the rich and the poor, the distance between those who are sick and those who are not, the distance between those who have better health care and those who do not. So there's a need to bridge that social distance, and we should not keep that social distance. We can be physically distant to avoid disease, but we shouldn't be socially distant from our from the suffering of our kababayans, from the situation of a lot of Filipinos who are living in poverty and in less than ideal healthcare situations. So that solidarity is really important, not just for uh, in actualizing that solidarity in those, in realizing what those situations are, but actually using that solidarity to visit the communities. To, and it's one thing to provide material support, but it's really another thing for those communities to see that there are people in solidarity with their struggles, in solidarity with what must be done, and speaking the truth to those in power of what should be done and what are the rights that our kababayans continue to not have in their communities. So I guess that's our call with regards to our allies, our kababayan in the US or wherever they may be, that we really need to strengthen, no? That our sense of community is still present, even if we're miles apart. But hopefully it's something that we do understand, that we have an obligation and we have a responsibility to each other, that as a community, it is only as a community that we're able to transcend not just disease, but the problems in our rights, in our poor situation. That as a community, as an international community and as a Filipino community, we have a lot to offer with regards to helping our disadvantaged kababayans in not being socially distant, but in remaining in social solidarity with them.
Wow. Thank you so much, Ate Minet and Dr. Josh. You actually summed it up. Indeed, our solidarity in addressing truth to power, precisely the point behind the Foundation for Philippine Progress. We have been very much aware of the struggle of our kababayans back home, and we hope to spread this awareness in this community in the context of reaching out to you. And with that, we thank you again for your time. Obviously, this is not going to be the last as we try to go through this journey of solidarity. So I would like to give it back again to Sel. And once again, marami pong salamat.
Thank you all. And now to just go over some call to action and going over some of our raffle winners. Uh, we're gonna do that and then we'll wrap up for the night. So again, we just want to invite you all to please make sure that you follow us on social media so that you can learn more about the work that we're doing and also what's going on with our different partners on the ground in the Philippines. So we are at Philippine Progress on Instagram and on Facebook. And we also invite you to be our partner for progress. Involvement ranges from, just being part of our mailing list to attending our events, donating, hosting a fundraising effort for us, and even, like going with us on the medical mission to the Philippines. Lastly, we really encourage you if it is within your means to continue to donate via our website, philippineprogress.org/donate. Or by setting up a Facebook fundraiser, for your birthday, or if it's even if it's just any other day, like if you find it in your heart to start a Facebook fundraiser so that we could continue to help our partners in the Philippines. As you have seen in the presentation, these simple acts of generosity do so much in the lives of our kababayans in the Philippines. We learned that like this is not the only answer, but like all of the support that we're able to give help our kababayans, help the frontliners, help our partners on the ground in strengthening their fighting capacity in the Philippines. So thank you all again for those who like were able to join us in the raffle by donating at least $5 today, and I will pick the two winners. So first, for this malong scarf from Mindanao, I have the names in here, so I'll just pick one. So for this malong scarf, we have for our winner Marilu from Portland. Congratulations, Marilu. So if you're still here, Marilu, please write your address or private message me on the chat room with your address. Otherwise, you could also send me your mailing address at info@philippineprogress.org. Congratulations, Mary Lou. And lastly, for our Philippines is on the Heart book, the winner for this is Patrick Cunanan. Congratulations, Patrick. Please send me your email or your mailing address so that I could mail you this book. You can send your mailing address to our email at info@philippineprogress.org. All right, so in the words of Carlos Bulasan, it is only when we have plenty to eat, plenty of everything, that we begin to understand what freedom means. To us, freedom is not an intangible thing. When we have enough to eat, then we are healthy enough to enjoy what we eat. Then we have the time and ability to read and think and discuss things. Then we are not merely living, but also becoming a creative part of life. As we've shared with you, we carefully curated the Philippines is in the Heart series as our own contribution in keeping the Philippines alive in our hearts. We wanted to utilize our platform to provide current and accurate bits and pieces of information about the Philippine history, culture, food, language, along with the current situation on the ground. We wanted to maximize our platform to get together with all of you to discuss any and everything about the Philippines and be a place where we can have truthful and meaningful discussion about what is dear to us. Here in the Foundation for Philippine Progress, we wanted to be a place to facilitate connections to the Filipino culture and traditions. And during that process, we also wanted to show the real conditions of our kababayans in the Philippines. That behind the rich history and tradition, many of our kababayans are in precarious situation, and that we can play a role in lending a hand to our kababayans despite the thousands of miles of distance between us. The Foundation for Philippine Progress has taught me and a lot of us that a full life is a life of purpose and a life of service to the people. And not just service to the people, but solidarity with them as well. Solidarity means being one with those we serve, living with them, facing their struggles alongside them, and struggling with them. Linking and raising our individual acts to the larger picture of advocating for a better future and for real change. And I invite you to continue to be a part of that. We invite you to be a part of our vision of a full life for every Filipino and continue to join us in making this vision a reality. So with that, maraming salamat po sa inyong lahat. Thank you for joining us. Thank you, Ate Minet, Doc Josh, our staff team, our board of directors, and all of the participants tonight. Thank you, Erna Cruz Tui of the American Center of Philippine Arts for donating original Rondalin music. We would love to hear any feedback you have on this webinar and the entire series. And we would love to hear if there are any more topics you'd be interested to hear in our future events. And you can leave us feedback at tinyurl.com/iheartphfeedback. We are so thankful for all of you for being with us in the 7-part webinar journey. This is just the beginning. Magandang gabi po sa mga taga-US and magandang umaga sa mga taga-Pilipinas. Maraming salamat sa inyong lahat. Thank you very much.